Hello, my name is Sayori Aworh. I am a nurse practitioner student. Thank you for coming in today. I understand that you've been experiencing some urinary leakage and pain during intercourse, and you'd like to know if there's something you can take over the counter that could help. Based on the symptoms you've described, I believe you are experiencing something called genitourinary syndrome of menopause, or GSM. This is a very common condition that affects many women after menopause. After menopause, your body produces much less estrogen. Estrogen helps keep the tissues of the vagina, the bladder, and the urinary tract healthy, moist, and flexible. When estrogen levels decrease, these tissues become thinner, drier, and more sensitive. This can cause symptoms like vaginal dryness, burning, irritation, painful intercourse, urinary urgency, and even urinary incontinence, which is the leakage you're experiencing right now. The good news is that these symptoms are common and there are treatments available that can help. Since you're looking for an over-the-counter option, I would recommend a product called Replenish Long-Lasting Vaginal Moisturizer. I found this product at CVS in the feminine care section. The price was approximately $25, that can vary based on the package size. You can also find it a lot cheaper at Walmart for about $13. So I'm gonna show you a picture of what the product looks like. This is what it looks like at Walmart. However, at CVS it does the box looks a little bit different, so just make sure it's the same product. It's called Long Lasting Vaginal Moisturizer. This product is not a hormone. Instead, it uses it adds moisture back to the vaginal tissues, and it helps them stay hydrated. Many women find that it helps decrease the dryness and it makes intercourse more comfortable. One important thing I want you to understand is that this is not a lubricant. A moisturizer like Replenish is used on a regular schedule whether you're sexually active or not. The directions recommend inserting one applicator into the vagina every 3 days, preferably at bedtime. A lubricant can be a little bit different. Some brands include Astroglide or KY jelly. They are used only before sexual activity. Lubricants reduce friction during intercourse and can provide additional comfort. Astroglide goes for about $8.98 at Walmart, and KY for around $6 to $10, depending on the size. So this is an image of the KY lubricant, and then this is an image of Astroglide. But there's a lot of different brands. Even the Walmart brand, the CVS brand can be a lot cheaper than the name brands. Most women are able to tolerate Replenish very well, but some may notice mild irritation, itching, or increased discharge after using it. If you develop any significant discomfort or worsening symptoms, you should stop using the product and come in to have your symptoms evaluated. There are also some things that you can do at home to help improve your symptoms. Try to avoid scented soaps, bubble baths, vaginal sprays, and douches, as these products can cause irritation and make the dryness even worse. Staying sexually active can also help. It helps by improving the blood flow to the vaginal tissues and helps maintain flexibility. Because you're also experiencing urinary leakage, I will also recommend pelvic floor exercises. They're also known as Kegel exercises. These exercises help straighten the muscles that support the bladder and can improve bladder control over time. To do a Kegel, tighten the muscles you would use to stop urinating. Hold it for about 3 to 5 seconds, then relax for about 3 to 5 seconds. Repeat this exercise about 10 times and try to do 3 sets each day. Many women notice improvement in the bladder control after several weeks of regular exercise. If your symptoms do not improve after several weeks of treatment, if you develop vaginal bleeding, if you have frequent urinary tract infections, or if the urinary leakage becomes worse, I want you to schedule a follow-up appointment. There are prescription treatments available if over-the-counter products do not help provide enough relief. So we discuss your symptoms. They're related to changes that occur after menopause. My recommendation will be to replace long-lasting vaginal moisturizer every 3 days and a lubricant such as Astroglide or KY jelly before intercourse if needed. I would also encourage pelvic floor exercises and avoiding products that may irritate the vaginal area. Do you have any questions about the products or how to use them? Okay. Thank you for allowing me to discuss your care today.